Good afternoon and welcome to MedTech Crossroads. It's episode 45 today. Today is Friday, February 12th of 2021. We've got a fun show today. We're going to talk about the COVID news. There's some interesting things happening. And next, after that, my friend Rich Sheridan from Menlo Innovations is with us, telling us all about their successes as a company and also how they've adapted in this time of COVID, which is really interesting because if you know anything about Menlo, they're a company that's prided itself on all being in the same room and getting things done fast. So that's going to be really interesting. After that, Pitch Party Day 2. We're on the second week of February. So we're going to be having our second guest pitch today, and we're looking forward to that at the end of the show. After that, Q&A and check-ins. But without further ado, I am going to share the screen here, and we are going to go to the COVID news. COVID metrics, as you know, we've been using all throughout this covidtracking.com, which is provided by The Atlantic, the journalists from The Atlantic. It's been a wonderful source of truth about what's happening. The news continues to be good on hospitalizations, which, as you know, has been our favorite to track. Total staffed hospital beds in the U.S., 924,000. We are now dropped below 80,000 of those in use due to COVID. And so that continues to be good news on this, the second nationwide peak. The first two peaks, of course, were the Northeast and then the South and West. This graphic, new cases change in 7-day average. I didn't even put up last week's because it's nearly identical. There's a change of one state in the falling or staying the same categories, but generally great news there that the cases are falling in 41 states. So we're thankful to see that. Michigan, the numbers continue to drop, currently hospitalized, now below 1,500, up from a peak of about 4,200, which was higher than last spring's peak. Deaths continued to drop. Cases continued to drop. Good news across the board there, so we're very thankful. In terms of vaccine distribution, this is a place where we said last week there's been a lot of infighting. It's hard to find sort of good news, except if you look at what's happening nationwide, this slow, methodical march goes on. And every week, we're able to look at this graph from the New York Times and see that it's actually jumped 2.5% since last week in terms of the color coding on this map, which means that states are picking up the pace, they're moving it along. And of course, the rural states, for reasons that we've discussed, seem to be a little bit ahead of the curve. But overall, it's moving along. They just added this graphic, which I thought was really interesting. People look at their local thing and they say, oh, we're doing terribly at this. And yet, this graph just trends pretty linearly over its 7-day average as nationwide new reported doses administered by day just continues to trend up. So it's happening. It's getting rolled out, never as fast as anybody wants, but we continue to see that moving forward. Here's a couple of unique things, though, that some of our staff noticed and sent to me in prep for the show. This from Diagnostic Imaging. COVID-19 vaccine-linked adenopathies could mimic breast malignancies. That's not to say don't get the vaccine. It's just to say that they're starting to see that patients who receive the Pfizer or Moderna vaccines can experience swollen lymph nodes. And I guess that makes sense because your body is responding to the vaccine. But they're starting to notice that these can be mistaken for malignancies in mammograms. So just a little public service announcement here for anyone who may be getting a mammogram. Just double check this. Is your COVID vaccine history part of your record there? And is the radiologist taking that into account? Interesting development there. Good thing to be aware of. Also, the government investigating a massive counterfeit N95 mask scam. It's worse than that. These are branded as 3M masks, and they've been distributed in large quantities to 5 states. And so the feds are going after them. Of course, this is not much different from what we saw when the EUAs were first happening back last spring, and masks that were coming in from other countries where the test standards couldn't be validated. The government finally had to put a hold on them and just say, no, we're not accepting any masks from China in that case. So here we do have, though, misbranded 3M masks making it out widely. There's a picture of one of them in the bottom right. Also, something our staff uncovered this is a neat thing from michigan.gov/coronavirus, where you can see the laboratory tests by type and date, and you can see which percentage were positive over the course of the pandemic. You can see the total test numbers ramping their way up here. And of course, this last winter, the peak where also the percent positive ramped up as well. So that gives a wonderful chart. We always love data sources that we can look at and try to get different views on what's happening. And this is another great one from michigan.gov. So I'd recommend, if you're interested in the data, go there and have a look. And that's the COVID news for today. I want to go next to my guest, who today is Rich Sheridan of Menlo Innovations. Rich, if you're live with us, you can bring your audio and video up. And there he is, the man himself. How's it going, Rich?
Great, Gene. Good to see you.
Thanks for being here. So along with his partner, James Goebbels, Rich is the co-founder and chief storyteller of Menlo Innovations. And by way of introduction, I guess around the turn of the millennium, can I say that? Rich was with Interface Systems, a large public company that was thriving, doing well, but he was kind of at a burnout point in his career. And this was the #1 company in Michigan based on stock growth, and yet this was not a happy point in Rich's life. And his meeting James, they're working together, they're coming up with ways to really bring joy back into the process of product development, specifically software development. And this gave birth to their way of working, which for the last nearly 20 years has been how Menlo does things. They're a local legend and actually give tours of their facility to see how this is done. And Rich, I love it. You say that your mission is to end human suffering in the world as it relates to technology. That is just a phenomenal statement.
It's one of those big, hairy, audacious goals, Gene.
I love it. Now, that's what the company is about. But when Rich Sheridan gets up in the morning and says, "I've been doing this. I've changed the world as it relates to software. People are coming to me to learn how to run a business, how to run a tech business, how to do development, how to figure out what customers want." We're going to talk about that in a little while. What gets you out of bed in the morning? What's your passion? What's Rich Sheridan's passion that gets you up today in 2021?
Yeah, I think every entrepreneur has to ask this question continuously. Why did I do this in the beginning? What was it that drove me? What keeps me going to this day? And I will simply say this last year has been a big test of that question in my mind. I think about 3 months into the pandemic, on a particularly difficult and challenging day, I think I said the word retirement twice.
Wow.
Scared James just a little bit. Um, but I think the that was a pivotal moment for me. Once again in the history of Menlo, for me personally, I I faced sort of a mental challenge. This was a lot like going back and starting over again,
Mm,
becoming an entrepreneur yet again for the first time. And I'll admit, my first thoughts were, I I don't want to do that again. I I Menlo's set. We're going. We've got a thing going. I understand how it works. I've written books about it. Give tours. I lead tours. We teach classes, and all of a sudden, everything had to change. But it didn't take long before I got excited again. It started
mm,
getting me out of bed and excited again to think, no, you get to do something new. You get to try something in a different way, like you've never tried it before. And I got excited about that. And that's what's getting me out of bed now. And I think that's actually going to be an opportunity yet again when we go back. I don't think going back is going back to the way things were. The way things were are, we will retain many things of what we learned in the first 19 years of Menlo. This last year has taught us a great deal. The next version of Menlo that hopefully starts in a few months after those vaccines get widely rolled out, I think will be yet again another entrepreneurial opportunity of reinvention. And I'm excited about that.
that's really cool. I think it's a really important perception, and I heard it first from you to say it that way, that we're not going back to where we were. And people talk about a new normal as though we were in that right now. but we're not. We're in a unique phase that's different from the past, and it's different from where we will be, and that's going to be a blend of things. So I think that's a beautiful way to describe it. I want to mention for the audience, because we're not going to go today into all the details of what Menlo is in all of its normal ways. Rich has got some great books, Joy Inc. and Chief Joy Officer, which I highly recommend the audience takes a look at and reads, because they walk through in great detail. This isn't just a one idea company. You guys have broken down how do we do this in each part of the process, and you're walking people through. Okay, how do we address hiring? How do we tear down hero culture? How do we share our successes as a company? How do we estimate projects? And you go through all of this and all the reasoning why. So it's a wonderful resource, and I recommend the audience gets into it. Today, Rich, we want to focus on really two things, I think. And the first is for our audience that's engaged in MedTech, you're no stranger to the world of MedTech and software as it relates to medical devices and patient records and other things. So we wanted to start there and go into the world of MedTech. And then after that, I know a lot of our audience has the question of, how do I deal with all of this? How do I deal with work from home? I'm a startup. I've got things I've got to do. And you guys, more than anyone, were so in person based that now you have done a great learning, and we would love to learn from that. But if I take you back to the world of MedTech, I guess where I want to start is maybe you could tell us a little bit about your vision for customer discovery as it goes back to the beginning, because our audience has heard many times the FDA's passion for usability. Sometimes it's ill defined, sometimes they don't quite know what they're asking for, but boy, if you don't have it, you're going to hear about it. And you're no stranger to that. And this goes way back to the beginning of Menlo. So tell us a little bit about this.
Well, Gene, when we talk about ending human suffering in the world as it relates to technology, there are many constituencies we look for. We look for the people who pay for the work to be done, who often see projects spin out of control and miss deadlines and blow budgets and deliver poor quality. And that gets very frustrating for funders of technology
Mm,
projects. We talk about the people who do the work. I mean, our industry is one that typically operates in a death march culture, right? And, as you get closer and closer to some imagined deadline, people are working lots of overtime, lots of problems are going into the software because tired programmers make bad software. And so we wanted to end their suffering too. So we have a very unique culture that avoids overtime and keeps human energy high and that sort of thing. But our primary focus, if we were to weigh them all, the one that outweighs all of them is to delight the people we intend to serve, who are the end users of the software.
mm,
That is probably the most forgotten constituency in software development in its history, right? Talking about the customers of Menlo. I'm talking about the people who buy the products from the customers of Menlo, and even they aren't the users, right? That might be a purchasing department that buys AccuReflow cytometers to put in labs around a place like the University of Michigan. But ultimately, there is a lab person who's sitting down at a device with a computer and they start to use it. And they're either going to be delighted by it, which is rare, or they're going to be incredibly frustrated by it, which is common. And that kind of suffering, that's what we really wanted, was to bring joy to the people who use the work of our hearts, our hands, and our minds. In order to do that, this wasn't about cleverer programmers. This wasn't about new tech widgets and shiny objects and all that sort of thing. This was something as old as anthropology. We
mm,
call it high tech anthropology, but this is the idea that we need to go out into the world like an anthropologist would and study the people we intend to serve in their native environment. And it's not as easy as, how would you like this to work? What do you think? Is this good? No, you literally have to learn from them. Learn where they're making mistakes in products they already have. Where do they get frustrated? What vocabulary did they use? What are their goals as human beings? What's their workflow like? And how will this fit into that workflow? Because if you don't understand that, you're going to deliver a product that is kind of the worst version of software failure. You'll deliver a product that never gets used. And there is no joy in that, right?
and we've all encountered those types of products in our life over and over again.
Yeah, I think, my history is as a programmer. It was very frustrating for me if I worked on things that never saw the light of day, or if they did, they never got used, or if they got used, people hated them.
Mm.
And that is, I think the joy of an engineer is to see their work get out into the world and delight the people it's intended to serve. In order to do that, you better understand them, and that's where our high-tech anthropology practice comes in.
I know in your book you say that at any given time, not more than maybe half of Menlonians are term you guys use for your staff yourselves. Uh, Not more than half of them are programmers. So
Right.
this anthropology aspect is actually a relatively large part of
Yeah,
the
it's about
practice and the
about
business.
25% of our team are anthropologists. And it's what this says on their business card. You can imagine if you hand a business card to somebody at a party and it says Menlo High Tech Anthropologist, it starts a really fun conversation.
And how do they go about their work? Because I think this is very instructive because you've come to this in an organic, we don't want software to be bad kind of a way. We'll go down to sort of how it relates to FDA in a little bit, but what does this look like when somebody just goes out there and says, I want to delight the users? FDA is usually trying to say, please think about the users. And you guys are actually saying, we want to delight the users. What does that look like? What's the mental framework and the physical practices that somebody goes through to be a good high-tech anthropologist in your business?
Well, a good high tech anthropologist should have a big dose of empathy and compassion for the people who one day be served by the product that we're creating. They
Mm,
should also have an intense amount of curiosity and and this is the hard part, particularly for engineers like me. I don't think I would be very good at high tech anthropology. Close your mouth, open your ears, open your eyes, and through observation, see things that others don't see.
mm,
Now, I will tell you, it begins though with the first time somebody comes to Menlo. They'll walk in our door and they'll say something like, "Hey, I hear you guys build apps or software or this sort of thing or that." They're like, "Yes, we do that." "Well, we need one of those." "Awesome." And then we ask them a question that confounds them. "What problem
mm,
are you trying to solve?" You're like, "What?" The problem is I don't have an app." I'm like, "No, that's a solution. That's not a problem." We must go back and start with the problem. Too many people come with their shiny objects and they think the world will be the path to my door. If we don't actually solve a real world problem, if we don't know what the problem is, and I will tell you, it is not unusual for our high tech anthropology team in the earliest parts of their discovery work, which is where everything starts, and we're attempting to define the problem. The problem is actually different than the customer thought it was. And that doesn't always go well with our customers. They're like, "No, no, no, I want you to solve this problem." Like, well, actually, that is not a problem. This is the source of the problem you're trying to solve over here. Once we've got a good understanding on that, and that's not us telling our customer what problem they're trying to solve, we're listening to them as well. We're trying to understand the business case. But again, if our view is we want to see this thing widely adopted by the time it gets out into the world, it's a big deal to do this kind of listening. Then we go out into the world and we start observing people who have this problem. We start to catalog them because there's different types of people. And we
mm.
start to create these things that the advertising industry has used for years, personas, not personas that come out of a little file cabinet of personas we have, but personas actually discovered through contact with the real people who have the issues that we're trying to solve. And then we prioritize those personas. I remember when we did the work for Accuray so many years ago in helping them define the software for the flow cytometer that they were going to bring to the world that quite frankly quickly revolutionized the world of flow cytometry. Um, when we brought those personas back, we have them prioritize using this bulletin board display of concentric circles, and we only let them put one persona in the middle, which is very frustrating for an entrepreneur who wants to capture a big market, make it work for everybody. Well, if you make things work for everybody, they don't work for anybody in particular. And they argued with each other between the lab expert and the lab assistant. All flow cytometers up to that point had been used by lab experts. No lab assistant could touch the flow
Mm.
cytometer because The work was so important, and the samples were carefully curated before they run through the machine, and it's a destructive process. And they put the lab expert in the middle. Jen Baird was there, Jack Ball was there, and we started arguing with them, presenting a different possibility. And they were arguing with each other about the possibility that if they could make it work for the lab assistant, their market would be 10 times the size, because no one had ever created a flow cytometer that could work for lab assistants. It always was only for the experts. And they
And
looked
that
at
right
us like,
there, you've
yep.
created a situation where, of course, it's the right answer, but it's an answer that's going to give you the status quo, and you're trying to change the status quo. Is the whole point here is to create something
And
revolutionary.
they did.
And they did. Yeah, it's a the accurate story is well known in the area.
And then, Gene, at that point, it becomes a process of design. And we don't go back to our whiteboarded conference room and dream up all these great ideas and think we have the answer. We create, much the same way we create software, we create iterative designs, carry them back out into the world, and assess the designs, not the users. We used to call it assessing the users. Like, no, we're not assessing the people. We're assessing our work. Where do they make mistakes? Where are they confused? Where do they stumble? We don't ask them, do you like this? We ask them, how would you use this to accomplish this particular goal you have? And at that point, they might look at it. And we're like, oh, what were you looking for? Oh, I was looking for a button that says this. Oh, well, we call it this. Oh, I'd never call it that. Great. Then we're going to
Mm.
call it what you'd call it. Most software is not designed this way, Gene. It's
Yeah, and
designed by
if
really
anything,
smart people.
they test it later, but they're not really listening necessarily. I've seen a few examples where it's different, but yeah, that's huge. And of course, that's the heart and soul of what FDA is really asking for when it comes to usability. They just want to see that, going back to the intended use and indications for use of the device, that it's going to do it, and they need some reasonable assurance of safety and efficacy. I think it's an interesting anecdote. You guys have been audited by FDA. You've had FDA walk through your doors to say, "Hey, what are you guys doing here?" And tell us a little bit about that process. What's it like to have FDA walk through your doors as a software company?
Well, these were not actual FDA badge carrying employees. They were FDA contracted investigators to take a look at our process and make sure it was following the standard. Make sure they're actually a very helpful group that comes through these examiners, because their goal isn't to knock you down. Their goal is to make sure you're in a spot that later, when you're trying to get FDA validation, that you're going to pass. And so they came in to see our place, and Gene, you know, you've been there. We use a paper-based planning system and handwritten story cards. Now, it's a little different during pandemic times, of course, but generally speaking, for 19 years, certainly during the Accuray time, that's what they came in and saw. And I think when they first walked in, they were like, oh my God, we'll be here for weeks. They left after a day asking us, could we bring other clients to see you, because we've never seen a process so rigorous, so followed, so believed in by your team, and so thorough from point of decision to point of implementation to traceability back to all those earlier decision points, that they were just astounded. And here's maybe the encouragement to your audience who might be working in this same place. The FDA isn't looking necessarily for big 3-ring binders with thousands of pages of documentation that are so hard to keep up. You're looking everywhere you can to cut corners on that. And that doesn't satisfy their needs either. They're actually looking for a fairly simple and straightforward path from decision point and who made the decision and when did they make it, to how did this decision get implemented in the product, to how are you sure that this decision is still being supported in the product, what's all the traceability, who signed off on everything. We have a fairly straightforward and very thorough system for doing that, and never had any trouble later with any of the documentation. For example, for the Accuray cytometer, when Becton Dickinson, who was the successor corporation, took it through the FDA process.
And I think when somebody walks through Menlo's doors, they could be tempted, as you sort of alluded to think, "Oh my goodness, the people everywhere just doing whatever. I don't see the structure. I didn't walk through the door, and I didn't see the shelf of binders, and I didn't see the rows of cubicles. Therefore, there's no way that this could be in order, because we've conditioned ourselves to think that order comes from this top-down imposition of all of these huge systems. And yet, what you guys have done, you lay it out really nicely in your books, is to say, what do we actually do here that succeeds
Mhm.
at this goal? And then you do it and you communicate it and you live it and you can explain it to somebody else. I
Yep.
think actually we weren't going to talk about this necessarily, but I think it's a neat aspect. You guys have, I think, been successful at having the Menlonians themselves talk about the process. This isn't just something that leadership sort of is able to live, but you've been successful at instituting that quality culture in FDA's terms
Yeah.
throughout the organization.
And I think that's another thing that they should look for if they're not is what's the human energy of this team when we walk in the door? Are they a downtrodden mass that's just going through the motions to fill out the documents just well enough to pass the test? I mean, this is kind of like what we're doing to kids in schools, right? We're teaching them to the test. That's not the goal of all of this stuff. The goal is to make sure you're creating a solid product that, at the one end of the spectrum isn't going to kill anybody, but at the other end of the spectrum can actually be used effectively for the care of patients, for the testing of patients, for improving human health. And this is what we need to be about in the space that you guys focus all of your attention in. That medtech space is so important these days, right? We wouldn't be anywhere near where we are today, even in the COVID crisis, without medical technology. It's becoming far, far more important than it's ever been before.
Well, and if more med tech companies would learn from your example, I think things would go even faster. That's something that we want to really push out there. And of course, you guys do trainings and tours for companies large and small, some of the biggest names in the industry and some of the smallest names as well. So the information is freely there. Go out and use it and find that link between how you can do this in a lean way, which the folks at Menlo really have. I got to ask you though. So this is the big elephant in the room, Rich. You guys made your name in. We're going to put everybody in the same room. In fact, Aaron Carter from our team had worked with Menlo during the Accurate days. That's one of the big reasons that we have an open floor plan at the office. It came out of that. Some of our things like stand-up meetings and things like that we do. I mean, we're sort of disciples here coming along afterwards. You've had a huge effect on local companies. The downside of that is COVID comes and hits in 2020, and we're using, paper to put it up on the walls. We're all standing around. We're passing a Viking hat during our stand-up meetings. First of all, what were those first few days like? Everyone in the audience here is wondering, okay, how do you do this? If you can switch from everything in person right now to online and survive, okay, there's hope for the rest of us. But what were those first few days like as you did this?
Yeah, and tell you what, Gene, I'm going to just share a little video because some of your listeners may not have ever seen Menlo before, and I'll just talk over the video because there's no sound to the video, so I'll just talk about it. So here we go. So this is Menlo for 19 years, our latest instantiation. Everybody working in a big open room, no cubes, offices, walls, or doors, people sitting shoulder to shoulder with one another, sharing a keyboard and a mouse as we work in pairs. We switch the pairs every 5 days. We're constantly using what we lovingly refer to as high-speed voice technology to communicate with one another. We don't use electronics. The team, for all of its years, has pushed the tables front to front and side to side. They actually want to be shoulder to shoulder with one another. And yes, we have that daily stand up where we pass the Viking helmet around, everybody grabbing the same device. You can't imagine, I don't think, a better environment for spreading a serious communicable disease than the one I just showed you. And so when that week of March 16th hit us, it was like a fire drill. Get out of the building, get out as quick as you can, grab as much equipment as you think you need. Anything you forgot to grab, we will transport it to your homes. And we had to set up a new Menlo and set it up in a hurry.
Hmm.
And I will tell you, for me personally, I panicked. I thought, this is the end of Menlo. This is the Menlo I have talked about for 19 years, written books about, given tours, spoken as keynotes at conferences around the world. And now it's all the opposite of what I had so proudly touted. Now, I will tell you, I learned an important lesson in this. There were two kind of almost standard jokes I would tell about Menlo in the old days. People would come in and they'd see this and they'd be like, oh, this is really cool, but what are the serious problems you have? And I would always say, number one problem at Menlo, communicable disease. Now,
Oh, that was telling the future right there.
yeah, and and I would just, we would talk about the Menlo kennel cough, and in the winter, we lose a lot of people to sick days and that sort of thing. We tried to be careful. I don't think we'll ever be as careful as we will be if we ever get back together again. I think there'll be a lot more washing of hands and people staying home when they're sick and all the things we've learned in this past year. And the other one was people would say, of all the things you do at Menlo, what's the one thing you would hang on to? And I say, well, working in pairs in an open and collaborative environment is probably one of the most important parts of Menlo. And if the government ever told us that we can't do that, it's probably the end of the company. And then I'd say, but why would the government ever tell us we couldn't do that?
Oh my goodness. Wow.
So I'm going to learn to keep my rhetoric down to a very narrow path here. But I will tell you what I learned, Gene, was something that was a lesson that I needed to learn. We had spent 19 years creating this intentionally joyful culture. That was like pouring a strong foundation under a strong building. And then a storm came and tried as hard as it could to blow our building down. And the culture is what we fell back on. The principles and the practices got pulled apart.
Mm,
The principles remain: teamwork, collaboration, trust, relationship, empathy for our customers and one another, care for the team, human energy. All of those remained. Our team adapted incredibly fast. We're doing all the things we used to do. We're pairing every day, but remotely. We had been
mm,
practicing remote pairing with our clients for 7 years. We have been embedding their people with ours over remote connections continuously for 7 years. So it wasn't a completely foreign concept to pair. We just never done it at the scale of the whole company. A lot of our paper-based, well, all of our paper-based artifacts had to switch to electronic. It's not that hard to imagine how you can do that. And so we just started embracing all these tools, and we had to invent a few new things along the way. One of them was people couldn't find each other. They couldn't do the "Hey Gene" thing, the high speed voice technology. So the team just put together a very simple shared drive Google sheet that has names on the left and video meet on the right, because everybody in our team is in a one-on-one video meeting all day long. So if we share that link with the rest of the team, if somebody wants to come talk to you and I, just click on the link and boom, they're in our meeting. And
mm.
so the speed at which they adapted was pure delight. And I remember this magical moment for me where I knew we were going to be okay. Uh, Obviously, it isn't just how we work at Menlo with each other, it's how we work with our high tech anthropologists going out in the world and studying people in their native environment. And we had to adapt that too because we couldn't go do that. And I remember Molly, one of our senior high tech anthropologists, at the beginning, we had this new project. We had to figure out how we were going to do high tech anthropology remotely, which we'd never done before. And she leans in, she goes, "This will be so exciting to figure out how to do this." And all I could think was, thank you, Molly. Boy, did I need to hear that. Right. So the
Mm.
energy of the team was the same energy that's been there all along, that problem solving energy, that let's run the experiment energy, that make mistakes faster energy that has carried us for 19 years. It was just critical in this last year. And we did it. We made it through. We adapted. I believe in my heart of hearts we are emerging stronger from this than we've ever been before. And finally, after a year of tough economic times, we are thriving again.
That's incredible. In your books, you talk through each of these aspects of your business. So you've got the high tech anthropology, you've got things like project estimation. How do we estimate projects? And hint, it involves the programmers themselves asking, okay, what are we going to do on this? High speed voice technology, obviously replaced by video chats now. Your hiring system, you called it extreme interviewing. And each of these things, can you take us on a walkthrough? And I guess I can go through a sort of a list here. How would you say it's shifted? So for the high tech anthropologists, I mean, I know they used to go out and actually be with people. That's less available now. How are they dealing with that? And for anyone who's working in discovering needs of a user, this could be very informative.
Yes. So early on, they simply started orchestrating with people who we're going to study. We did this project for a company in Texas shortly after the pandemic started. Normally, that would have been our anthropologist going down and spending a few days, getting on an airplane, spending a few days down in Texas. And of course, that wasn't practical at that point. I'm not even sure it was legal at that point. I don't think anybody was flying anywhere at that point. And certainly, the mandate has been if you can work from home, you must work at home. And so the question was, could we do it? Well, the team said, well, we're going to investigate how they do things today. So, what we're going to do is we're going to get them on a Zoom call like this, but we're going to have them share their screen so they can show us what they're working on.
Mm,
The work of the anthropologist is often to get our end users that we're studying to think out loud. Don't just do it in your head. Actually talk it out as you're walking through things, as you get frustrated, as you find something that doesn't work the way you want it to. And we're observing them actually doing this work. And we've got this live video connection with them so we can actually watch their body language. Because a lot of times people won't necessarily verbalize everything they're thinking. So we're watching for body language. We're watching for people squinting their eyes and pausing for a little bit. Oh, what were you looking for? Oh, I can always find it, but this time I can't find it. And we find out every user says the same thing, like, oh, that might actually be a problem. And so then the anthropologists take that information and then they begin to work together. Now, again, they work in pairs just like our programmers do. And they're so used to post-it notes and whiteboards and whiteboard tables and all that sort of thing. And they had to figure out how to find collaboration tools online so they could work. And again, I will simply say, even today, none of this is ideal, but it works. And they're adapting and they're making it work so we can continue to do our important work on behalf of our customers.
that's really a good way to put it. Yeah, it's not ideal, but they can make it work. One of the things you've told me before, Rich, is the need to destroy the hero culture, and it was a revelation to me. You talk about it in the book as well, but this idea that it makes sense to us that a given person, because they're good at something, should be the one to do it. And what that tends to do in a company is to everything of that sort goes to that person. They get pigeonholed for that thing. They get overwhelmed with that thing. Everyone's waiting on them for that thing. And you guys take a very different approach with your paired programming to make sure that everyone gets cross-pollinated so that the best person at it is more often maybe teaching it than doing it so that others can learn, which I think everyone should learn from. But talk to me about this hero culture. I imagine that it will try to raise its ugly head the further apart people are. And so while Zoom and Teams and other things are limited ways of doing it, how do you try to get back that everybody's available to everybody else? We can bring that person into a discussion. You mentioned the Google Doc to be able to click on it, but clicking is very different than just yelling across the room and saying, "Hey, what can you do?" Do you see the hero culture try to reestablish itself in this remote working thing? And if so, how do you fight it?
I think for us, this is all about the culture. And I know we might touch on before we finish our hiring practices and begin teaching that culture from the moment of first contact. And the idea of Menlo is the idea of improv theater. When you step onto the stage of improv, your job is to be the least important person on that stage and help everyone around you succeed. And that has transcended into this work from home environment. The structural things we do are also very important. It's not just that we pair people, it's that we switch the pairs every 5 days. We're very systematic about essentially making sure the knowledge is being transferred amongst all of the team members. And then what we do is we watch carefully, and our team even self monitors this. Uh, Keeley, one of our longtime team members, has been on the Bucky project for about 9 months. That's one of our code named projects. And and she by her own admission the other day on a tour, she said, I was getting complacent. I'm good at this. This is in a field I knew, a language I'm
Mhm.
very comfortable with. And she raises her hand and says, you know what? I might not be the best person. She was self-identifying. I'm getting into that hero mode. And just last week, she moved to the Derby Project. She's being mentored. Keely's been with us over 15 years. She's being mentored by Dan, who's only been with us a couple of years, because it's all new technologies, all new tools. Keely's back in student mode again. And I think the real key to this, Gene, is making sure we shift the reward systems inside of our team mentality.
Mm.
If companies, all they hear, if every employee hears 259 out of 260 days, 52 times 5, teamwork, 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 but when we get into the annual performance review,
It's all
we only
individual
hear about
based.
yeah, we only hear about individual goals. It doesn't take a smart person very long to say, oh, I get it. That teamwork stuff, that's just a bunch of BS. This is all about my individual performance. I don't need to outrun the tiger. I just need to outrun you. And so in this way, we're constantly communicating into our culture. Don't hang on to knowledge, share it with others. If you know something more than another person, teach it to them. And even the longtime employees, they love learning something new. Keely will still be available to the Bucky team. She is no doubt an expert at what's going on in Bucky, both for the 9 months she's been on the project and the body of work she's done before that. The team won't hesitate to reach out to Keely, and she won't hesitate to share the information because she still wants them to be successful. And again, I think this has to do with that purpose driven focus. If your goal is to delight people out in the world with what you do, it becomes far less about me, who I am, what I get to hang on to, what my tower of knowledge is, what my heroic structure is. And we've gotten a little wacky in over many decades now, in particularly in American work culture, where if you go home at night, somebody says, "Hey, Gene, how's work?" and you're like, "Oh man, I'm going crazy. I don't think I can even take a vacation this summer." And it sounds painful, but there's really a great source of reward in that comment, because what you're saying is they can't live without me. I don't know
Mhm.
what they do without me. I am central to everything they're working. Yeah, I know it really it sucks that I don't see my family. I can't enjoy a vacation. Even when I go, I have to take my laptop and be checking email the whole time. And yes, I'm destroying the relationship with my children, but I'm really important here. And we don't have that. That's not a goal of our company. And we communicate that through everything we do, including our interview practice.
That's amazing. And we've actually got some questions coming in here. We'll need to go to those in just a second. But why don't you? I think it's a very important part of the discussion, Rich. So take just a couple minutes here and describe to us that interviewing practice, because you kind of throw people in at the deep end on that one and give them some unexpected things. So
Although,
tell us what.
people self report that it's the most comfortable interview they've ever been in because we're not asking them any questions. What we've turned our interview into, Gene, is an audition of, do you make another person succeed? And so what we do is we pair candidates one with another for 20 minutes and we watch them work together. And we do it in a group setting because that's Menlo. We're doing this in a group setting every day. We switch the pair partners every 20 minutes with another candidate and we give them the weirdest instructions ever. Gene, if you're paired with Aaron, your job is to help him get the second interview, even though he's competing for the same position. And in this moment, just by saying that, we are teaching our culture. We're looking for good kindergarten skills. Do you play well with others? And I'm delighted to say, because this was for 19 years now, this has been a 100% in person, shoulder to shoulder event. And just last night, for the first time ever, we ran the experiment. We did a virtual extreme interview with 10 people and it worked. It was mind blowing how well it worked. And the team was self reporting, wow, that felt like the real thing. And we got some really good candidates out of that. And we're going to be hiring a couple of them.
That's awesome. So even your internal team that was already on the team was saying, "Hey, this works well enough to
Yes.
be like
Yeah.
what we
Yeah, I
do."
mean, the external people, the candidates coming in, kind of didn't know what the old version. So we told them a little bit about it in the preamble to the event itself. But this is, but again, what are we doing? We're pairing over video. This is the way we work now. So it makes sense to interview over video because this is the way they're going to work. So we try as hard as we can in our interview process to simulate the work environment and give people a chance to experience what would it actually feel like to work at this weird place called Menlo.
That's just a phenomenal process. I could ask you questions for hours, and as people have heard, I mean, you're one of the companies that we at Into Being have modeled many of our practices off of, but still don't live up to half of them. So I recommend everybody the book Joy Inc. and Chief Joy Officer, which is just a wealth of information. I got to go take some questions here. We've got Dr. David Brophy on the line. David, are you live with us there? It looks like you're muted. Just unmute.
Okay. Yeah, it's good to be here. And Rich, I got in after you started talking here, so I don't claim to know everything that you spoke of, but it sounds like something that would be really good for us with respect to our symposium, which is coming up in April, because we are as well, doing it by Zoom. And the usual difficulty in that is that investors have to look at a pitch that is canned in a sense, and then have to interview with an entrepreneur. And we are all, and all the people I'm sure that are in the audience here are in one way or the other entrepreneurs who pitch or investors who hear pitches. I think this is a very valuable approach that you're taking. And I'd love to know how to put it in a can and use it in the symposium. So, what are your thoughts? Because there's two big uses that stare us in the face. One, pitching to investors. The other is doing online due diligence. And both of those suffer from inability to travel anymore.
Right.
And are both open to Zoom, that type of approach. But the skill sets that are becoming obvious, I guess you'd say, deficiencies, get in the way of that really working well. What are your thoughts?
I think in general, David, and great to hear from you, by the way. Haven't seen you in a while. One of the things we had to make sure we preserved in our shift to an online environment is fostering the relationships between people. I mean, ultimately, this is still about the humans. And so, for example, I think this is going to sound like such a simple construct, but just getting people to turn on the cameras.
Yeah.
Right? Seeing each other, seeing smiles, seeing body language, seeing eyebrows. This is important. And then creating opportunities for actual conversations, not just blaring out presentations where it feels like everybody's disconnected. So I think you probably want to look at the scale of each set of conversations. Maybe you keep them fairly intimate. Maybe it's just a half a dozen people that are getting together with a founder who's putting out a pitch deck to potential investors. So that, because I think at a certain size of a Zoom meeting, no matter how bold the people are, they just tend to sit back and just go into listening mode only. And what you want, I believe, is interaction. You want deep conversation. And I think you have to create opportunities for that. And of course, the delightful thing is because no one's traveling, they should actually have more time for that than
right,
because they're not spending the time on airplanes, getting into the hotel room and all that kind of stuff. So, and it might be that you don't, I mean, now I'm going to go off a little bit on a sort of Rich Sheridan crazy idea tangent. Maybe the event doesn't all have to be in 1 or 2 or 3 contiguous days, because the reason you did that is because everybody was traveling and they were all together. So there might be a tail of opportunities that come out of the big event that allow people to have those ongoing conversations going forward.
Rich, last year we did this last year when we were hit by the lightning bolt of all of this, and we kept it going for 2 weeks.
Nice.
And exactly the way you said it, because number one, we had 70 companies to show, and not everybody could cover 70 companies, in a reasonable time. So it just took longer, and they stuck with it. So, and the groups tended to be smaller too. A lot of them were one-on-one, that sort of thing,
And I bet those
So-
are much higher quality conversations.
I
than
think
you
so.
would experience.
And it gets you the intimacy or whatever the word is that you were suggesting, so.
And I think too, the other thing that all of us should be looking at, no matter what our situations, what problems we're trying to solve, is I think we've spent so much time like feeling the pain of the pandemic.
Yeah.
We've stopped looking for the new opportunities that are occurring in this
Oh, yeah.
time. We've seen them at Menlo
Oh, yeah.
throughout the entire year.
Yeah. There's tons of them. There are absolutely tons of them. Colleen, my daughter, she's transformed her whole fitness company. It's all online now.
Yeah, no, I did the same thing with my fitness instructor. He's reinvented his whole business and it's more profitable than it's ever been.
Yeah. Well,
Dr.
thank you
Brophy,
very
thank
much.
you very much.
That impels me to buy the Joy of Cooking or whatever this was, the Joy Inc.
Joy Inc. Go out and get it. Dr. Brophy, thank you for your question.
Joy of cooking software. I like it.
Okay.
I want to get time in here for one more question from Ken Spencer. We've just got about a minute here before we've got to go to the pitch party. But Ken, I wanted to give you a chance here to ask your question.
Thanks, Gene. Hi, Rich.
Hey.
So it's been a while since we got to see each other. Glad to see we're both vertical. So years ago, I got the opportunity to attend several of your weekly meetings.
Mm-hmm.
We started to work together, and I was always wondering now how you were doing that, but I think you explained it pretty well. So the question is, do you think you'll ever go back to your former model, or will you do a hybrid model now?
Well, I spent the first 3 months of the pandemic just believing it was going to be done in 8 weeks, right? And so I spent 12 weeks believing it was going to be done in 8 weeks. And so my initial thought pattern was just tough it out. We'll be back to the way we were. And then, of course, didn't happen that way. And at this point, none of us know when we'll be back. We're probably going to be, number one, the last people to be able to go back. And we'll be laggards even at that. And so there are things we've learned in the last year that we're not going to let go of. It would be silly to let go of some things that we've learned in the last year. So I think the next version of Menlo, I can't fully predict how it will look, but it will be different than the old version. It will grab pieces and parts and honor those pieces that we can still do. But there are things that we have done in the last year that have absolutely made us stronger, and we will hang on to those. I mean, the simple one is we started doing virtual tours last June. That was the first time we've ever done a virtual tour. And now we're doing about 5 or 6 a week. We've touched people from 46 countries and 37 states since June. Why would we turn that off? And so the worldwide reach we've been able to affect simply because we had to would suggest there'd be no reason to stop that. Will we go back to in person as well? Of course we will. People like to come see it, feel it, experience it. But the democratization of those tours, because people can come from all over the world now without getting on airplanes and the expensive hotel rooms and the expensive time and all that sort of thing, we will absolutely hang on to that.
Yeah, great question, Ken. Appreciate that. Rich, how can people get in touch with Menlo Innovations? You guys are all over the place. You've even got your Twitter handle right there on your physical backdrop, so you get credit for having a physical backdrop in your space there as well. We always like to give kudos for that. Any important ways for people to get in touch with you? Obviously, get the book.
Yep.
And Erica
Menlo,
just posted, if you're interested in a virtual tour.
Go to our website, menloinnovations.com, click on tours and workshops. We do at least 3 free tours a week. And so you can just come in, they last 90 minutes, they get rave reviews. Bring your friends, tell your friends. If you want to talk to me directly, Sheridan at menloinnovations.com. I'm a crazy guy about email. I think when I started this conversation with Gene, I had 4 emails in my inbox. So I keep up with email. That's the one thing. Don't call me and leave a voicemail message. You may never hear from
Never coming back.
It's not me being rude. I just don't pay as much attention to that as I do to email.
Rich Sheridan, co-founder and chief storyteller of Menlo Innovations. Thank you for being with us today.
Thanks for having me, Gene.
It was wonderful. Thanks again. Next up, I am excited to announce it's the second week of the pitch party. And I want to remind you all of what we're now calling the Walt Young rule. Pitch parties are artificial things, but it's a fun way to get into a discussion about startups. We can have an interesting discussion about what startups are like, what's good, what's bad, what we like, what we don't like. Pitching and running a business aren't the same things. And so when our judges at the end of the month award a winner, it's more for fun than anything, but we want to have an interesting discussion about each of these startups. And I won't read this again, but we said it last week. Remember the example of Fred Smith, the entrepreneur who started FedEx and was told that his idea wouldn't work because it wasn't feasible. And of course, now FedEx, a market leader. So again, the criteria for our startups, we started at the beginning of the month. US MedTech startups can send their pitch decks, which have to cover areas of problem statement, vision, value proposition, team, milestones, business model, competitors, and their ask or functional equivalent areas to pitch party at medtechcrossroads.org. And with that, I want to introduce Zhifeng Ko, who is with EagleView Imaging, and Zhifeng is going to be presenting EagleView's pitch deck today. Welcome, Zhifeng.
Okay, thank you, Gene, for your invitation. And good afternoon, everyone. So my name is Zhifeng Ko from EagleView Imaging. Today, I'd like to talk about the brain surgery. We know brain surgery is very complex, difficult, and expensive. So after surgery, over 1/3 of brain tumor patients would have complications. Surgical complications are always devastating. So why do surgical complications happen at all? Myself is a professor of radiology. I specialize in medical imaging. I work with neurosurgeons every day and feel the pains. Right now in the field, all of the medical images are collected as the two-dimensional medical images. The doctors have to read these two-dimensional images to think about a 3D shape looks like. So the mental reconstruction of 3D based on 2D is very difficult. Any misinterpretation could lead to a potential surgical complication. So what we do is that at EagleView, we develop patent pending technologies to reconstruct the 2D images into 3D objects, anatomy like this. So the surgeons can play this 3D anatomy precisely and without mental imagination. This would eliminate the human error in the 3D interpretation. So how the product looks like. So this light demo of our product. The first case is a brain vascular case. Instead of looking 2D images, the doctors can manipulate and look at this 3D object directly. Another case is a brain tumor case. Look at the brain tumor and also the colorful functional pathways of the brain. If you touch some important functional pathways, the patient might not be able to walk or talk. So you can see these functional colorful functional pathways are very complex. It's very difficult to imagine using a human brain. So using our technology, we would allow the surgeons to plan the surgery precisely. So value proposition, before the FDA approval, right now our product is being used for the resident training and also patient consultation by our customers. After FDA approval, our product will be used for surgical planning and are used together for the surgical navigation as well. So what makes our product different from the others? Right now, our competing devices, they either using Microsoft HoloLens or using this VR headset goggle. Both of these, the product lines, they are all using head-mounted devices. They're bulky and heavy, and the user response is very sluggish. Over 1/3 of the users complain about the dizziness, not comfortable to use. And plus, their system charge is pretty high. They charge at least $500,000. Compare-wise, our system is a desktop system. As you see on the video, it's a desktop. Everybody uses a desktop computer. It's very easily integrated into your everyday workflow. And also our system offers a much higher resolution imaging resolution and with a much smoother user experience. And also it's much more affordable. We charge only $50,000. Even the neurosurgery department, they're also very budget sensitive. So the market size, our beachhead market will be the neurosurgery. Worldwide, it's about close to $1 billion. If you further expanded this technology to other clinical fields and all other surgical fields. The total market size is about $18 billion worldwide. Our revenue model. Before FDA approval, right now we are selling our system as a training system. We charge $50,000 for the first year. After that, we charge $20,000 each year as an annual license fee. After FDA approval, our price will be doubled. There's currently a CPT code available. You can charge the patient for each use. And also, our hardware cost is less than $7,000. Our go-to-market strategy. We are going after these resident training programs right now to market our system as a training system. We also leverage our chief medical officer and the clinical advisory board to introduce our product into the market, and also engage pilot partners in US, include Henry Ford Hospital and also China, to validate the value of our system, and also develop strategic partners like Medtronic, Brain Lab, or Stryker. So later, we'll present our cases and also present our study at the CNS meeting called Congress Neurological Meeting and AANS meeting, and also publish our papers and advertise and grow sales as well. For clinical partners, Henry Ford Hospital is our official clinical partners. The doctors from DMC and also University of Michigan already agreed to be our clinical partners. We also have 3 additional Chinese teaching hospitals agreed to be our clinical partners as well. So our progress, our company formed in the end of 2017. And after that, we have filed a 1 PCT patent. We have 2 more USA patents to be filed in 2 weeks. We have sold 2 units last year, despite of the pandemic situation. Our prominent customer, paid customer, and also the clinical side include Henry Ford Hospital. We also received a letter of intent from the Spectral Health and also University of Michigan. Right now, we are working with Henry Ford Hospital to do clinical studies to validate the value of our system and also deliver more sales on the way. And we're also planning to launch a Chinese subsidiary early this year. So the goal for our this year's sales is to accelerate the momentum of the sales. And Spectral Health already approved the purchase of our system. Right now, they're pushing for the request for funding at the department at the hospital level. It will go through. And University of Michigan also offered a letter of intent. In addition, Henry Ford Hospital is also planning to purchase several more systems in line. They cannot wait for our system to be approved by FDA so they can use it in clinical setting. In addition, we also have 3 hospitals more in our pipeline, in our pipeline of potential sales. That's the plan for the 2021. Our management team, I'm the founder and the CEO of the company. I'm a tenured professor at Wayne State University. I have over 15 years experience in medical imaging. That's my field. Been funded by NIH, DoD, and NFL committee. So this project is just a natural commercialization of my research work. We also have a co-founder, Francis Glory. And Francis is a serial entrepreneur. He played a key role in over 6 startups. And also our acting chief medical officer is Mark Rosenblum. Dr. Rosenblum is the former chair of neurosurgery department at Henry Ford Hospital. He's a national leader in neurosurgery. He won the Lifetime Achievement Award from Congress Neurological Surgeons and American Association of Neurological Surgeons. In addition, we are also planning to recruit a VP for business development in charge for sales and marketing. This person will be our potential CEO once the investment commitment is secured. So our key opinion leaders include Steve Kakanis. Steve is the current chair of neurosurgery at Henry Ford Hospital. He's also the president of Congress Neurological Surgeons. He's also CEO of Henry Ford Medical Group. We also have Dr. Zhengfeng Wang. He's the vice chair of neurosurgery at the Zhengzhou University Hospital in China. This is the biggest hospital in the world. And also we have an imaging guru, Dr. Mark Hickey. He's a pioneer in MRI imaging as our technical advisor. Our roadmap. So far, we are open for the seed round right now. For the seed round, we are planning to prepare the FDA 510(k) clearance paperwork. Meanwhile, it will support for our training product sales. That's for the plan for this year. Next year, we will do the Series A. The goal is that once we get the FDA approval early next year, we will plan our product launch. That's used for that Series A. Then for the Series B, the reason is that we'll launch our product for the second FDA approved product. And also we expect to get FDA approval by that time. So and from the Chinese market, from the China and also CE mark. So the funding overview, to date, we have raised $780,000. Among the funding, $700,000 from angel investors, $80,000 from the government funds and the grants. So right now we're open for the seed round. Seed round, investment, $1 million. The proceeds will be used for the product development, FDA clearance, and the sales marketing. Among these $1 million, we are planning to raise the first $350,000 to generate 2 sales and also prepare for FDA and also recruit a VP for business development. So far, we have already have one institutional angel investing institution doing the market due diligence with us right now. So after that, we'll do the Series A. So the financial projection, we expect to break even by 2024. We would expect to make the revenue about $33 million by 2025. For our exit strategy, these companies will be our potential buyers of the company because our product offer much better user experience and added value to their existing company. So this is my contact information. Thank you very much for your time.
Zhifeng, thank you so much. Great job there. And I always want to ask the companies questions, but we've decided we're going to let each presentation stand on its own for the judges on the 26th of February, so we hope you can join us. But I do have this one question, and actually I'm wondering why my video's not back up. Are we back up, Steve? We seem to have a video problem right here. We'll bring it right back up.
Stop share screen. Okay.
There we go. Now we're back up. And that's this. You've been in diagnostic imaging for many, many years. And now you're doing this startup, and it's really cool. The question I always like to ask each of our guests is, what is the passion and the motivation that drives you as an entrepreneur and as a researcher?
Okay, that's an excellent question. I appreciate. Myself as a tenured professor, I did intensive research. My field is translational research. I also try to translate technology into the bedside. But even so, given the tons of papers I published, I still see the limited impact. My dream is that I want to create some technology, some product, so to really deliver to the market, to impact the field, so that by the time when I retire, when my grandson or granddaughter asks me, "Grandpa, what do you do?" I can proudly tell him that I designed this kind of product that right now doctors are using it every day to help the patients. That's my dream. That's my passion.
Wonderful. Well, thank you so much for being with us. We appreciate it, and we appreciate your presentation. Be sure to tune in on the 26th. At the end of the month, we will have our judges reviewing this and the other 2 presentations. So, Dr. Ko, we appreciate your being here today.
Okay, thank you very much, Gene. I appreciate your invitation. Thank you, everyone.
I just want to make one more quick share here. Our friend David Weaver over at Cityside Ventures alerted us to this last week, and I'll just put it up for everyone's remembrance today, that Cityside Ventures is running a deal tank. If you like pitches, there's another one happening February 23rd, and so you can go to citysideventures.com /thedealtankfeb to get involved there. And again, if there's anything you want to let us know about, what we're going to do is we're going to leave the line open for a little while longer here, just to see if anyone has any announcements of things happening in the community, Q&A on things that we've talked about on the show, or anything you want to let the community know. We'll leave the line open for just a minute more before we close the show, and I'll stop the share here. Let's see, I see a couple of hands raised here. Dr. Brophy, your hand is up and we are live.
Well, I just want to let your folks know that we're taking applications for the 41st Michigan Growth Capital Symposium, which is now being presented as part of the Midwest Venture Showcase. with firms, companies from the Great Lakes states, and investors from literally all over the country. And so, we've put about 1,500 Michigan firms through the program over the years, and it's a very good way to pitch to venture capitalists who you might not be in contact with normally. So if you've got a package that you would like to be considered, just send it to me. My email is djbaroffi@umich.edu, and you'll be part of the mix.
Dr. Brophy, that's great. We just popped the website for MGCS Midwest Growth Capital Symposium up here on the
Terrific.
on the thing, but DJ Brophy, BROPHY @umich.edu. Thank you, Dr. Brophy. Appreciate having
Thank
you
you
here
very
today.
much.
Talk soon.
Pardon me? Yep, bye.
Looks like we've got another Q&A here. We're just going to check that before we close down. This is interesting. Note from Ken Spencer. Sounds like we might hear more next week about it. Do I have an insight? Quarantine recommendations from the CDC for vaccinated individuals are currently under review at Michigan Medicine. Updates regarding impact to faculty, staff, and learners will be communicated next week. We do not have any information on that right now, Ken, but sounds like a good thing to look into for next week, and hopefully we'll find out something about that. We'll give one more second in case there's any other questions, comments, etc. And again, just like Dr. Brophy did, if there's an event happening you want to let people know about, please don't be shy. Pop in. This is a great way to cross-pollinate. I do want to let you also know, I was talking with Matthew Himes, who runs the A2 Biosocial. They're doing that every month too. He'll come on the show in a few weeks to tell us about the next installment of that. But for now, thanks for being with us on MedTech Crossroads. I appreciate each and every one of you. And great show today. We're looking forward to next week and the third installment of the pitch competition. So we'll talk to you next week. Thanks for being here. Bye-bye.